Hi, it's Kathy Kress again, and I am back with my Geriatric Care 1 YouTube channel, and we are at the playlist Death and Dying, and this is the 6th episode, and we are now going to look at the 5 phases of illness and that lead to death and dying, or go through death and dying. So there's before the diagnosis, before any symptoms are occurring, and the older person and the family don't really know what's going on, but they know they have to see a doctor to find out what's going to happen, and it leads to a diagnosis of terminal illness. There is the acute phase, the chronic phase, the recovery phase, and the terminal phase. So we're going to talk about that. Before the diagnosis, what is your role as a geriatric care manager? Well, the patient just starts noticing symptoms, pain, whatever, and they're worrisome, and so needs to go to the doctor and finally acquiesces to that. Lots of times people put off that for a long time. And then the doctors do test, and you come up with the patient recognizes he or she has a terminal illness. So before this pre-final diagnosis, what's your job? You schedule appointments for the older person to see many doctors. You help the family to ask questions, because again, you're giving them self-efficacy. You're advocating for them, really asking questions about what's going on, because they're baffled and sometimes intimidated by the medical system, which is a maze. And you are basically helping them to advocate for the older person and themselves. You are maintaining a care plan, because you have a care plan the whole time, a care plan for the older person and a care plan for the family, because this is a very hard, and you always do that, have a whole family approach, but this is one of the most difficult junctures for the family. You go to medical appointments. The geriatric care manager should be, if the family agrees, they don't want to do it, take the older person to the doctor and prepare, and I go through that many times. What are the questions you need to ask? You have 10 minutes to do it. Be prepared ahead of time, ask those questions, help the older person advocate for the older person, asking their questions, get it all done in those 10 minutes, write it all down, take the older person to the pharmacy, pick up the meds and get them home, and don't have the meds stored in the garage. Okay, set up a personal health record. And I just did a blog about this. There's not the greatest personal health record, but online, Microsoft's Health Vault is a really good one. I think Google's gone. And just do that research and try to find out what would be the best online. And this is for the family. The family usually are baby boomers. They can do this, and set up a personal health record so that the family can keep track of all the doctors, all of the medications, everything that's happening. So they're really in control, and they can do it through a personal health record. It could be done. If they're not willing to do it, they're just too bereft and they're not going to do it on their iPhone or whatever, they can do it on a piece of paper. They can do it in a folder. As long as they're just keeping kind of a journal and list of the doctors and the questions that they're going to ask, and that is your job as a geriatric care manager. So I'll see you next time. Go to my website, kathykress.com, and check out my blog. I always coordinate the blog with the YouTube series. So I'll see you again next time.